Good morning, everyone. I'm excited to welcome you to today's presentation. We will be exploring the topic of minor ailments and standing orders. This is a vital area, especially for healthcare professionals, as it helps us understand how to manage common conditions efficiently. Today, we'll cover what minor ailments are, how standing orders can streamline treatment, and the importance of safe practice. I look forward to sharing valuable insights with you all. Let's get started. Welcome to this section on the treatment of minor ailments and emergency management, which is a crucial part of primary health care. When we talk about minor ailments, we're referring to slight illnesses, small emergencies, as well as both acute and chronic conditions that require immediate attention. It's important to recognize that these are often manageable at the primary care level, which helps prevent complications and reduces the burden on higher-level facilities. Nurses play a vital role here. They need to be skilled in examining signs and symptoms, so they can accurately assess the condition and provide prompt treatment if it's a minor ailment. This capability is essential because timely intervention not only alleviates patient discomfort, but also ensures better health outcomes. Overall, understanding how to handle minor health issues effectively ties into our broader goal of accessible, comprehensive primary health care. When managing minor ailments, it's essential to prioritize creating a safe and healthful environment for our patients. This means ensuring their surroundings are clean, safe, and conducive to recovery. We need to treat any risk or injured person promptly because quick action can prevent complications and help the patient heal faster. For infectious diseases, taking appropriate measures to prevent the spread is crucial. This could include proper hand hygiene, using protective equipment, or isolating the patient if necessary. Continuous observation is also key. Regularly checking vital signs helps us catch any changes early and respond promptly. Helping clients perform their activities of daily living, or ADLs, supports their independence and overall well-being. Providing health education is equally important. Teaching patients about their condition and how to care for themselves empowers them to participate actively in their recovery. We must also remember our limitations. Not everything can be treated at our level, so recognizing when to refer a patient for specialized care is vital. Supporting the family members is part of our role too. They often play a significant part in the patient's care and adjustment to their condition. Respecting the beliefs of our clients helps build trust and ensures that care is culturally sensitive and patient-centered. And lastly, if there's any doubt about the diagnosis, or if the patient's condition seems serious, we should refer them without delay. Timely action can make all the difference in outcomes. In essence, following these principles helps us provide safe, effective, and compassionate care for those with minor ailments. Now, let's take a closer look at the classification of minor ailments. This is an important part of understanding how we approach these common health issues. Essentially, minor ailments can be grouped into different categories based on their nature and how they affect us. By classifying them, we can better tailor our management and treatment strategies. Most of these ailments are self-limiting, meaning they tend to resolve on their own without the need for extensive medical intervention. However, recognizing the specific type of ailment helps us determine when simple home care is enough and when to seek further medical advice. In this slide, we're emphasizing the importance of understanding these classifications because it directly ties into the overall theme of empowering individuals to manage their minor health problems effectively and responsibly. This knowledge is fundamental in ensuring appropriate self-care and avoiding unnecessary healthcare utilization. Today, let's talk about some common minor ailments that we might encounter in everyday life. These include injuries and falls, which can happen during simple activities but still require proper care. Fractures are more serious and often involve broken bones, so recognizing the signs is important. Burns, whether from hot surfaces or liquids, can cause pain and damage, so knowing how to treat minor burns is essential. Dog bites are another concern, especially in outdoor settings, and they can lead to infections if not handled correctly. High fever and heat stroke are conditions related to overheating, particularly in hot weather or during physical exertion, and they need prompt attention to prevent complications. Diarrhea, although common, can lead to dehydration, so staying hydrated is key. Fainting might occur due to dehydration, low blood sugar, or other causes, and understanding how to respond can make a big difference. Overall, these minor ailments are frequent but manageable if we know what to do. Recognizing these conditions early and knowing basic first aid can help us respond effectively and keep ourselves and others safe. Today, I want to talk about some common systemic minor ailments that can affect our eyes. These might seem small, but they can significantly impact our daily lives if not addressed properly. Let's start with eye accidents, which are often caused by minor injuries or mishaps that can happen at home or work. Even a small bump or scratch can lead to discomfort or more serious issues if not treated promptly. Next, foreign bodies are another common problem. Things like dust, dirt, or tiny particles getting into the eye. These can cause irritation or infection if not removed carefully. Moving on, infection is a key concern, especially when the eye's natural defenses are compromised. Infections can cause redness, pain, and sometimes even vision problems if left untreated. Poor eyesight, whether it's due to refractive errors or other issues, is also very common. Many people experience difficulty seeing clearly, especially in low light or at night. That's where night blindness comes in, which can be particularly troublesome because it affects your ability to see in darkness, increasing the risk of accidents. Finally, dry eyes are a frequent complaint, especially in environments with low humidity or for those who spend long hours in front of screens. Dryness can cause irritation, a gritty feeling, and sometimes even blurred vision. All these conditions highlight how vital it is to pay attention to our eye health, recognize symptoms early, and seek proper care to prevent minor issues from becoming more serious. After all, healthy eyes are essential for a good quality of life and overall well-being. Let's talk about some common ear issues. Earache is a frequent complaint, often caused by infections or pressure changes. Sometimes, foreign bodies like small objects or insects can get stuck in the ear canal, leading to discomfort or even injury. Otitis media, which is middle ear infection, is another key point. It's quite common, especially in children, and can cause pain and sometimes fever. Ear discharge, or otorrhea, can occur when there's an infection or injury, and it's important to identify the cause to treat it effectively. Lastly, temporary deafness can happen with ear infections or obstructions, but it often resolves once the underlying issue is addressed. Recognizing these symptoms and understanding their connections helps us better diagnose and manage ear problems as part of overall health. Let's take a closer look at the respiratory tract and some of the common conditions that can affect it. Allergic rhinitis, for example, is an allergic response that causes sneezing, nasal congestion, and itchy eyes. It's often triggered by allergens like pollen or dust. Then there's the common cold, which is caused by a viral infection and leads to a runny nose, sore throat, and fatigue. Sinusitis involves inflammation of the sinuses, resulting in facial pain and congestion. Sore throat is another frequent complaint, which can be due to infections or irritants. Cough, of course, is a protective reflex but can also be a symptom of underlying issues. Dyspnea, or difficulty breathing, indicates respiratory distress and needs prompt attention. Chest pain can be caused by various conditions, some related to the lungs or heart, making it essential to evaluate thoroughly. Lastly, an asthmatic attack is a sudden worsening of asthma symptoms, causing airway constriction, wheezing, and shortness of breath. Recognizing these symptoms is crucial because they highlight the importance of proper diagnosis and management within respiratory health. All of these conditions remind us how interconnected and vital the respiratory system is to overall health. Now, continuing with our discussion on the cardiovascular system, let's focus on some common conditions that can affect heart health. First, we have hypertension, which is essentially high blood pressure. It's a major risk factor because it puts extra strain on the heart and blood vessels, increasing the risk for heart attacks and strokes. Next, anemia is another condition worth noting. Although it's often associated with blood, it can also impact the cardiovascular system because when there's a lack of healthy red blood cells, the heart has to work harder to supply oxygen throughout the body. Then there's rheumatic heart disease. This usually develops after untreated or poorly treated strep throat, leading to inflammation and damage to the heart valves. It highlights how infections can have long-term effects on heart health. All these conditions underscore the importance of early detection, proper management, and overall cardiovascular health. They remind us that maintaining a healthy lifestyle and seeking timely medical care can make a significant difference in preventing serious complications. Continuing with the digestive system, let's look at some common issues that can affect this vital part of our body. First, toothache, a pain that can really bother us and often indicates dental problems or infections. Then we have stomatitis, which is inflammation inside the mouth, making eating and speaking uncomfortable. Soreness in the mouth can also be caused by various factors, including infections or irritation. Constipation and diarrhea are two opposite issues involving bowel movements, constipation making it hard to pass stool, and diarrhea leading to frequent, loose stools. Both can cause discomfort and dehydration if not managed properly. Indigestion, or dyspepsia, is a common complaint that can cause bloating, nausea, and discomfort after eating. Vomiting is another symptom that can signal various underlying problems, from infections to food poisoning. Abdominal distension, or bloating, often accompanies indigestion or other gastrointestinal issues. Pain in the abdomen can be a sign of many conditions, from minor issues to more serious diseases. We also need to be aware of intestinal obstruction, which is a blockage that prevents food or liquids from passing through the intestines and requires urgent medical attention. Hemorrhoids are swollen blood vessels in the rectal area, often causing pain, itching, and bleeding. All of these symptoms highlight how interconnected and delicate our digestive system is. Recognizing these signs early helps in seeking proper treatment and maintaining overall health. Remember, these issues are common, but they also remind us of the importance of good digestive health practices. Now, moving on to the urinary system, let's discuss some common issues that can arise. One of the symptoms you might notice is burning micturition, which is a burning sensation during urination. This often indicates an infection or inflammation in the urinary tract. Another important point is hematuria, or blood in the urine. This can be caused by infections, kidney stones, or other underlying conditions and warrants further investigation. Urinary retention of urine is also a significant concern. It refers to the inability to empty the bladder completely. This can happen due to blockages or nerve problems and can be quite uncomfortable or even painful. Urinary infections are quite common, especially in women, and can cause symptoms like urgency, frequency, and discomfort. It's crucial to recognize these early to prevent complications. Finally, renal stones, or kidney stones, are solid deposits that form in the kidneys and can cause severe pain, hematuria, and urinary obstruction. All these points highlight how vital the urinary system is and how various issues can impact overall health. Recognizing these symptoms early and understanding their causes is key to effective management. Let's continue with the neuromuscular system and how it can be affected. You might notice that issues here can manifest as headaches, which are quite common and often linked to tension or other neurological factors. Backaches can also be related to nerve compression or muscular strain involving the nervous system. Convulsions and epileptic fits are more severe symptoms that indicate disruptions in the brain's electrical activity. These manifestations highlight the vital connection between the nervous system and muscular function. Recognizing these signs helps us understand the importance of maintaining a healthy neuromuscular system, as problems here can significantly impact overall health and well-being. This ties back to the broader theme of how interconnected our bodily systems truly are. Let's continue exploring the reproductive system, focusing now on some common issues women might experience. One of these is dysmenorrhea, which refers to painful menstrual cramps that can really affect daily life. It's important to recognize when these cramps are severe or unusual, as they can sometimes signal underlying conditions. Another concern is heavy bleeding, which isn't just a matter of inconvenience. It can lead to anemia or other health problems if not properly managed. Sores or ulcers in the genital area are also noteworthy. They might be caused by infections or other medical conditions, so paying attention to these signs is crucial. Discharge from the genital area is another common issue. While some discharge is normal, any change in color, smell, or amount could indicate an infection or other health concerns that need medical attention. Breast lumps are also significant. Not all lumps are cancerous, but any new or unusual lump should be evaluated promptly to rule out serious conditions. Overall, these symptoms highlight the importance of paying attention to our reproductive health and seeking medical advice when something seems off. Recognizing these signs helps us maintain overall well-being and catch potential issues early. Continuing on, let's take a closer look at behavior problems. When children face difficulties in adjusting to their environment, we often see maladjustment. This can manifest as challenges in coping with everyday situations or social expectations. It's important to recognize that maladjustment is not just about poor behavior. It often stems from underlying emotional struggles. Next, emotional disturbances are a key component of behavior problems. These disturbances might include feelings of anxiety, depression, or mood swings that significantly impact a child's ability to function effectively. Understanding these issues is crucial because they are interconnected. When a child experiences emotional disturbances, it can lead to maladjustment, which then manifests as problematic behaviors. Throughout this presentation, we're emphasizing how vital it is to identify and address these emotional and behavioral issues early on. Doing so can help guide children toward healthier coping strategies and better overall development. Let's take a look at the general steps for managing minor ailments. When someone comes in with a minor health issue, our goal is to handle it efficiently and safely. The first step is to gather a thorough history of the problem. This means asking questions about the onset, duration, and severity of the symptoms, as well as any previous episodes or treatments. Next, we need to perform a careful physical assessment. This helps us understand the severity and any underlying causes, while also ensuring there are no signs that require urgent medical attention. After assessing the situation, the third step is to consider whether the ailment can be managed with self-care or if it requires referral to a healthcare professional. For minor ailments, many can be effectively managed with over-the-counter remedies, lifestyle advice, or simple reassurance. Throughout this process, it's crucial to provide clear advice to the patient about how to manage their condition at home, including warning signs that should prompt them to seek further help. Finally, documenting the case thoroughly is important, both for ongoing care and for legal reasons. By following these steps, we aim to ensure that minor ailments are managed safely, effectively, and within the scope of our practice, ultimately supporting the overall theme of providing competent and compassionate care. Now, let's talk about standing orders. Standing orders are essentially instructions or directives of a specific nature that guide healthcare providers. They come into play especially when there's a situation where doctors are not immediately available. In such cases, nurses and other health workers are empowered to provide treatment to patients. This can happen at home, in a hospital, or any health institution, and these instructions are usually provided in written form. It's important to remember that these standing orders are meant to be used on a temporary basis, such as during emergencies or when a doctor is absent. They ensure that patient care continues smoothly without unnecessary delays. So, the key takeaway here is that standing orders help maintain continuity of care when immediate medical supervision isn't possible, ensuring that patients receive timely treatment even in challenging situations. This concept really ties into the overall theme of ensuring safe, effective, and responsive healthcare delivery. Vamos falar sobre o objetivo desta etapa. Primeiro, e acute fundamental garantir a continuidade do tratamento do paciente. Isso significa que, mesmo em situações de emergência, precisamos assegurar que o cuidado não seja interrompido, mantendo a atenção às necessidades do paciente de forma contínua. Outro ponto crucial e acute prazo de vida do paciente, ou seja, devemos estar preparados para resgatá-lo e realizar as ações necessárias para manter-lo vivo. Isso envolve técnicas de resgate e intervenção rápida, que podem fazer toda a diferença nesse momento. Por fim, é acute importante criar sentimento de responsabilidade entre todos os membros do equipe de saúde. Cada deve entender seu papel e agir com compromisso, pois essa responsabilidade compartilhada é acute essencial para oferecer o melhor cuidado possível. Esses objetivos estão diretamente ligados ao tema central de nossa apresentação, que acute a importância do trabalho em equipe e de preparação na assistência ao paciente em situações críticas. Nosso foco deve estar sempre na segurança, no cuidado continuo e na responsabilidade coletiva. Now, let's look at some of the key uses of this approach. First, it allows us to provide treatment during emergencies, which is absolutely critical in saving lives. By acting swiftly and effectively, we ensure that patients get the care they need when they need it most. Another important point is that it helps enhance the quality and activity of health services overall. This means that health services become more efficient, responsive, and better suited to meet the needs of the community. It also plays a vital role in strengthening primary health services within the community. When primary health care is robust, it becomes easier to prevent illnesses and manage health issues at the local level, reducing the burden on hospitals and specialized facilities. Decentralization of health responsibilities is another key benefit. By distributing responsibilities more evenly across different levels of health care, we improve access and ensure that services are more localized, timely, and tailored to specific community needs. A significant goal of these efforts is developing a sense of confidence and responsibility among nursing and other health workers. When they feel empowered and trusted, they provide better care and are more motivated to serve their communities effectively. Protecting the general public from quacks is also crucial. By establishing credible, professional health services, we reduce the risk of people falling prey to unqualified practitioners who may do more harm than good. Finally, all these measures help to enhance the public's faith in our medical institutions and community health services. When people see consistent, quality care, their trust grows, which ultimately leads to better health outcomes for everyone. Now, let's take a closer look at the different types of standing orders. Standing orders are a key part of managing recurring transactions, and understanding the various types helps us ensure smooth financial operations. The most common types include the fixed amount standing order, where a set amount is transferred regularly, and the variable amount standing order, which adjusts based on certain conditions or needs. Then there's the time-based standing order, scheduled to occur on specific dates, and the demand or conditional standing order, which is triggered by specific events or thresholds. Recognizing these types allows us to choose the right approach for different situations, making our financial processes more efficient and reliable. This understanding ties back to the overall theme of effective financial management and control. Let's talk about the management of minor ailments as per standing orders. This approach is designed to streamline how we handle common, minor health issues. Essentially, standing orders are pre-approved protocols that enable healthcare professionals to manage specific conditions efficiently. They help ensure patients receive timely care while maintaining safety. The key points here are understanding which ailments fall under these standing orders. Things like minor colds, minor skin infections, or simple injuries, and knowing the specific treatment steps that are allowed without needing a doctor's direct intervention each time. It's important to highlight that following these protocols helps us deliver consistent and safe care, especially in settings where immediate medical consultation isn't always possible. By adhering to these standing orders, We also ensure that we're working within our scope of practice, providing effective treatment while minimizing unnecessary delays. Connecting this to our overall theme, managing minor ailments properly is a crucial part of patient care. It allows us to free up resources for more serious cases and improves patient satisfaction because they get prompt attention. So, understanding and correctly applying these standing orders is vital to our role in providing efficient, safe, and reliable healthcare. Fever is essentially an abnormal rise in the body's temperature, exceeding 37 degrees Celsius or 98.6 degrees Fahrenheit. When you see a fever, it's often a sign that something isn't quite right within the body. It indicates that there may be some abnormal functions happening, such as an infection or other diseases or disorders. Now, when managing a patient with fever, the primary step is to assess their vital signs thoroughly. This helps us understand the severity and monitor progress. It's also important to gather a detailed history, asking about possible causes, and checking for other symptoms like vomiting, shivering, cold allergies, or cough. Providing rest and light meals can help the patient recover more comfortably. In addition, preparing for a blood slide test to examine for malaria parasites is crucial if malaria is suspected. Administering paracetamol or PCM can help reduce the fever, and encouraging the patient to drink more fluids helps prevent dehydration. Cold sponging can be useful if the fever exceeds 39 degrees Celsius or 102.2 degrees Fahrenheit, as it helps bring down the temperature. It's essential to monitor the patient closely and observe their condition over the next 2 days. If you notice rashes along with the fever, it's important to keep the patient in isolation if needed and inform the doctor promptly. In cases where the patient experiences delirium, convulsions, unconsciousness, or hyperpyrexia, which is an extremely high fever, immediate referral to a higher facility or specialist is necessary. Remember, these signs indicate potential complications that require urgent medical attention. Managing fever isn't just about bringing down the temperature, but also about carefully observing the overall condition and acting swiftly when serious symptoms appear. Let's talk about heat stroke. Heat stroke is a serious heat illness, and it's characterized by an extremely high body temperature, specifically over 40 degrees C or 104 degrees F. This happens due to environmental heat exposure, which causes the body to overheat. Sometimes, it's also called sunstroke, and that name highlights how closely it's linked to sun exposure. Now, the primary intervention is crucial. First, you want to move the affected person into a shaded and well-ventilated area to help cool their body down. Monitoring vital signs and recording them is important to keep track of their condition. Next, remove any tight or unnecessary clothing to help with cooling. You can also wrap the person in a wet sheet until their temperature drops to about 38 degrees C. If they are conscious, offering cold water mixed with salt or other cold drinks can help rehydrate and cool them simultaneously. Throughout this process, it's vital to continuously observe their temperature and overall condition. As soon as you notice signs of improvement, it's essential to refer the person to a hospital for further care. Remember, quick and appropriate intervention can be life-saving in cases of heat stroke. Diarrhea, which we often hear about, is defined as passing 3 or more loose or liquid stools in a day, or more frequently than what is normal for that individual. It's important to understand that this condition is actually the leading cause of malnutrition among children under 5 years old, and sadly, it's also a major cause of death in this age group. Usually, diarrhea is a symptom of an infection in the intestinal tract, often caused by bacteria, viruses, or parasites. When we approach diarrhea, the primary intervention involves careful history collection, understanding when it started, how often, and what other symptoms are present. Monitoring for signs of dehydration is crucial because dehydration can become severe quickly. If dehydration is severe and shock is evident, immediate referral to a hospital is essential to save the child's life. In less severe cases, we can provide oral rehydration solutions, or ORS, which are simple and effective. Additionally, giving rice water, coconut water, lemon juice, bananas, light tea, or light, easily digestible foods like cachati can help restore nutrients and fluids. If there's an outbreak of vomiting and diarrhea, collecting stool samples for testing can help identify the cause, especially during epidemics. In the case of cholera, which can spread rapidly, taking appropriate measures such as protecting food and water sources and informing health authorities is vital. Health education plays a key role here, teaching communities about controlling flies, proper disposal of waste, and maintaining food hygiene to prevent further spread. Lastly, medication should be given as needed, but always based on the specific cause and severity of the case. All these steps together form a comprehensive approach to managing diarrhea effectively and reducing its devastating impact on children's health. A burn is essentially an injury to the skin or other organ tissues, primarily caused by heat, but it can also result from radiation, radioactivity, electricity, friction, or chemical contact. When we talk about thermal burns, these happen when some or all of the cells in the skin or underlying tissues are destroyed. There are different types of thermal burns based on what causes them. For example, hot liquids, which we often call scalds, hot solids like contact burns from touching something hot, and flames that cause flame burns. Each of these can cause significant tissue damage and require prompt attention. Now, moving on to primary intervention, this is crucial. First, we need to check if the burn is spreading and work to stop the burning process as quickly as possible. If possible, immerse the burnt area in water to cool it down. This helps reduce tissue damage. If the person's clothes are stuck to the burn, do not try to remove them, as this can cause more injury. But if there are tight items like rings, bangles, shoes, or belts, these should be removed carefully to prevent swelling and further complications. It's also important not to touch any blisters unnecessarily, because they protect the underlying tissue and can become infected if ruptured. Cover the burn with a clean cloth to protect it from dirt and infection. Next, we need to assess the person's overall condition and estimate the percentage of the body that's affected by the burn. If the person is conscious and not vomiting, giving oral rehydration therapy, or ORT, is advisable to prevent dehydration. If the person shows signs of shock, then primary treatment for shock must be administered immediately. Pain management with analgesics can be provided if necessary. Finally, the person should be referred for further medical care to ensure proper healing and treatment. Remember, quick and correct initial action can make a big difference in recovery outcomes. Drowning is a serious issue that involves experiencing respiratory impairment due to being submerged or immersed in liquid. It's important to understand that males and children are at a higher risk of drowning, which highlights the need for vigilance around water, especially with vulnerable groups. According to the World Health Organization, drowning is actually the third leading cause of unintentional injury death worldwide, making it a major public health concern that we all need to be aware of. Now, if we find someone who has drowned, the primary intervention is crucial. First, gently loosen any tight clothing around the chest to help them breathe more easily. Then, carefully position the person so they are lying on their abdomen, that's on their stomach, and gently work to get the water out of their lungs. This step can be vital in preventing further respiratory damage. Next, resuscitation is often necessary. This might involve CPR or other resuscitative efforts to restore breathing and circulation. And of course, once initial help is given, it's critical to get the person to a health center or hospital immediately for further assessment and treatment. Remember, quick and appropriate action can save lives, and understanding these key steps can make a significant difference in drowning emergencies. Now, let's talk about animal bites and their significance. Rabies is a major health concern that we need to be aware of, especially after bites from dogs, cats, or monkeys. These animals can carry the rabies virus, which is almost always fatal once symptoms appear. It's important to note that every year, around 5 million people are bitten by snakes, which also poses serious health risks, although the primary concern here is rabies transmission from mammal bites. Focusing on monkey bites specifically, The key steps in management include proper wound dressing to prevent infection. If the person bitten hasn't been adequately vaccinated against tetanus, an injection of tetanus toxoid should be administered to prevent tetanus infection. Antibiotics are also crucial to prevent bacterial infections at the wound site. Most importantly, anti-rabies treatment should be given promptly to anyone bitten by a potentially rabid animal. This treatment is vital to prevent the development of rabies, which is almost always fatal once symptoms start. Overall, the main message here is that timely and appropriate intervention can save lives and prevent serious complications after animal bites. When dealing with a dog bite, the first and most crucial step is to thoroughly wash the wound with soap and water, preferably using running water. This helps remove dirt and reduce the risk of infection. Next, if available, apply an antiseptic like betadine or tincture of iodine to the wound to further disinfect it. In some cases, ARS or anti-rabies serum can be used for dressing, but it's important to perform a serum sensitivity test beforehand to prevent allergic reactions. If the wound is extensive, it's essential to check for any bleeding or hemorrhage. If bleeding is present, control it promptly. Remember, stitches should generally be done after about 24 hours, giving the wound some initial time to settle. Don't forget to give an injection of tetanus toxoid. This is a key part of preventing tetanus infection after a bite. Now, an important point to highlight. We should not kill the dog immediately. Instead, observe the dog for about 10 days for any signs of rabies. Finally, always send the patient to the hospital for anti-rabies vaccination therapy. This is vital in preventing rabies, which can be fatal if not properly managed. So, to sum up, immediate wound care, proper dressing, vaccination, and observation of the dog are all critical steps in managing a dog bite effectively and safely. Today, I want to focus on the primary interventions for a cat bite. First, it's crucial to properly dress the wound to prevent infection and promote healing. Next, if the person hasn't been vaccinated against tetanus, administering the TT vaccine is essential to provide protection. Antibiotics should also be given to combat any potential bacterial infection from the bite. Lastly, if there's a risk of rabies, administering the rabies post-exposure prophylaxis, or ART, is a key step. These interventions are vital to effectively manage the bite and prevent serious complications, tying into our overall theme of prompt and appropriate response to animal bites. Let's talk about the primary intervention for a snake bite. First, it's important to discourage traditional first aid methods because they can sometimes do more harm than good. Instead, focus on reassuring the person and keeping them calm. Remember, movement or contraction of the bitten limb can actually increase the absorption of venom into the bloodstream and lymphatic system, so limiting movement is crucial. Have the person lie down in a comfortable position to help slow the spread of venom. Immobilize the entire body if possible, and specifically immobilize the bitten limb using a splint and a sling. Use bandages or clothing to secure the splints in place. A very important point is to never use a tourniquet to block blood flow, as this can cause more damage. Also, avoid offering alcoholic beverages or stimulants, since they act as vasodilators and can worsen the situation. If there are rings, watches, bracelets, or footwear on the bitten limb, remove them quickly before swelling begins. Do not cut the wound or apply ice, as these actions are not recommended and can cause further injury. Finally, the person should be transferred to medical care promptly. All these steps are aimed at slowing the spread of venom and preparing the individual for professional treatment. When dealing with a scorpion bite, our primary goal is to provide effective intervention. First, if possible, try to remove the sting itself. Sometimes, this can be done carefully with tweezers or a similar tool. After that, apply a pressure dressing to help control swelling and prevent further venom spread. It's also important to reassure the client throughout, because staying calm can really help manage the situation better. For mild pain, applying ice packs can be very soothing and help reduce discomfort. However, if the pain is severe, we may need to administer local anesthesia like lidocaine without adrenaline to numb the area. Alongside that, Oral medications such as diazepam can help with muscle relaxation and pain, and NSAIDs are useful for reducing inflammation. Remember, observation is key. We need to watch the client closely for at least 24 hours to monitor for any signs of worsening symptoms or adverse reactions. Keeping a close eye ensures we can intervene promptly if needed. Overall, these steps are about managing the immediate effects of the venom, alleviating pain, and preventing complications, which ties into our broader goal of effective emergency care. Fainting, also known as syncope, is a sudden loss of consciousness that usually results in a fall. It can happen quite unexpectedly, and it's important to understand what causes it. The main reasons include reduced blood flow and oxygen to the brain, which is often the result of various factors. For example, pain can trigger fainting, as can emotional stress. Additionally, prolonged standing, laughing, or weeping can sometimes lead to fainting episodes. When we see someone faint, our primary goal is to intervene quickly and effectively. The first step is to lie the person down. If possible, the head should be positioned slightly lower than the feet to help restore blood flow to the brain. If the person is sitting, gently bend their head between their legs. It's also very important to clear the area of any crowd to give them space and reduce stress. Once the person regains consciousness, encourage them to take deep breaths to help stabilize them. Offering liquids, like water or juice, can also be beneficial once they are alert enough to swallow. But if the person remains unconscious or their condition doesn't improve, it's crucial to seek immediate medical treatment without delay. Remember, quick and calm action can make a real difference in managing fainting episodes effectively. Let's talk about injuries and fractures. So, a fracture essentially means a bone has been completely or partially broken. It's important to recognize that fractures can vary in severity, but the key is that the bone integrity is compromised. Now, when you encounter someone with a suspected fracture, your primary intervention should be to clean the wound carefully with soap and water if there's an open wound. Next, applying spirit around the wound helps to disinfect the area. After that, you should apply betadine lotion and then bandage the wound to prevent infection. Monitoring the client's condition is crucial. Keep an eye on their vital signs and overall responsiveness. Remember, fractures can sometimes lead to shock, so treating for shock is an essential part of your care. Immobilization is vital to prevent further injury. Using a splint to stabilize the fractured part helps reduce pain and prevents movement that could worsen the injury. Additionally, administering analgesics will help manage pain, and giving an injection of tetanus toxoid, if indicated, can prevent infection. Finally, it's important to send the patient to a hospital for further assessment and treatment. Proper initial care can make a big difference in recovery, so always follow these steps carefully to ensure the patient's safety. When we talk about a wound, we're referring to an injury to living tissue, usually caused by a cut, blow, or some other kind of impact. Most often, this results in the skin being cut or broken. It's important to understand that wounds can vary in severity, but the initial care is crucial for proper healing. Now, let's go over the primary interventions you should take when someone has a wound. First, always wash the wound thoroughly with clean, boiled water to remove dirt and debris. Following that, apply an antiseptic lotion to disinfect the area and prevent infection. It's also good practice to apply spirit or alcohol around the wound to further sterilize the skin edges. Next, carefully remove any foreign bodies like glass, pieces of wood, stones, or dirt that might be lodged in the wound. Removing these helps prevent infection and facilitates healing. After cleaning and clearing the wound, bandage it using betadine or a similar antiseptic dressing to keep it protected. It's also essential to give a tetanus injection, known as TT, especially if the wound is deep or contaminated, to prevent tetanus infection. Check the wound for bleeding. If bleeding persists, apply gentle pressure to control it. If the wound requires sutures, meaning it's deep or the edges can't stay together on their own, you should refer the patient to a hospital for proper suturing. Proper initial management can make a big difference in recovery, so always remember these steps and act promptly. Now, let's talk about the standing order for maternal and child health care. First, we need to understand what this means. Maternal and child health care refers to the health services provided specifically to mothers and their children, ensuring they receive the necessary support for a healthy pregnancy and early childhood. Moving on to the primary interventions, one of the key points is giving tablets in cases of vomiting and nausea. This helps manage common pregnancy discomforts effectively. In cases of toxemia of pregnancy, it's important to advise the mother to follow a restricted salt diet and ensure she gets complete rest. If there is edema, which is swelling, we should refer the client to a hospital for further management. If the mother experiences antepartum hemorrhage, or APH, or postpartum hemorrhage, known as PPH, she must be sent to the hospital immediately for urgent care. After delivery, if the mother develops a fever, it's crucial to understand the cause. Administering antipyretics can help reduce the fever, but she should also be referred to a healthcare facility for proper treatment. Providing comfort is equally important. For instance, if there is excess milk in the breasts, or if the mother has experienced a stillbirth, we need to support her emotionally and refer her for further care if necessary. It's essential to observe for any abnormalities or deformities in both mother and child, and refer them promptly for specialized care. Also, don't forget to provide warmth, which is vital for both mother and baby, especially in fragile conditions. Initiating breastfeeding as early as possible is another critical step, as it promotes bonding and provides essential nutrients to the newborn. All these actions are part of a comprehensive approach to maternal and child health, aiming to prevent complications and promote well-being at every stage. Let's talk about convulsions in children. A convulsion is essentially a sudden, uncontrollable muscle contraction or a violent movement of the body. It can be quite frightening to witness, but understanding what to do is crucial. When a child has a convulsion, the first primary intervention is to ensure their safety. I recommend gently lying the child down on a bed or a flat surface to prevent injury. Next, loosen any tight clothing around their chest to help them breathe more easily. It's also important to turn the child's head to one side. This helps keep the airway clear and prevents choking if they vomit or secretions come out of their mouth. Speaking of which, you should carefully clean any secretion from their mouth to reduce the risk of choking. If the child has a fever, applying a cold sponge can help reduce it. Fever often accompanies convulsions, so this can be a helpful step. Finally, try to identify the cause of the convulsion and refer the child to a healthcare professional for further evaluation. Remember, quick and calm action can make a significant difference in managing these situations effectively. Let's talk about hemorrhage. Hemorrhage simply means the release of blood from broken vessels. It can happen inside the body, which we call internal hemorrhage, or outside the body, known as external hemorrhage. When you encounter someone with bleeding, your first step is to help them lie down flat on their back. This helps prevent shock and keeps blood flow more stable. Next, quickly check their blood pressure and vital signs to assess their condition. Then, press a clean pad firmly on the point of bleeding. This is crucial to control the bleeding until it stops. Once the bleeding is under control, bandage the area properly to keep pressure and protect it from infection. If possible, give the person some liquids to help maintain their hydration. It's also important to try to find out what caused the bleeding, if you can do so safely, because that can influence further treatment. Keep monitoring their condition closely, especially watching for signs of stroke or worsening symptoms. If the bleeding seems uncontrollable or the person's condition deteriorates, don't hesitate. Refer them to professional medical help immediately. Remember, quick and calm action can make a big difference in managing hemorrhage effectively. Today, I will talk about unconsciousness, which is a state that occurs when a person loses the ability to maintain awareness of themselves and their environment. It's a serious condition that requires immediate attention. When someone is unconscious, our primary goal is to ensure their safety and support their breathing. First, we need to position the person properly, lying them in a way that allows their respiratory system to function correctly. Usually, placing them on their back is best, but always be mindful of ensuring their airway remains open. Next, if you're in a well-ventilated area, make sure they are lying there to promote airflow. If the person has dentures, it's important to remove them to prevent choking or aspiration. Also, gently clean any secretions from their mouth to keep their airway clear. Loosening the clothing around the neck, chest, and vest can help ease breathing by reducing any constriction. In cases where breathing is blocked, providing artificial respiration, like mouth-to-mouth or using a mask, can be life-saving. Finally, it's crucial to identify the cause of unconsciousness, whether it's due to a medical condition, injury, or other factors, and refer the person to a healthcare professional promptly. Remember, acting quickly and calmly can make all the difference. Now, let's talk about the role of the community health nurse in history collection. This is a crucial part of our work because understanding the patient's background helps us provide better care. First, we gather the general health history of the patient, which gives us an overall picture of their health status over time. Next, we look into the onset of the disease, trying to determine when it started and how it has progressed. We also pay attention to the severity of the illness, including its intensity and the symptoms they've experienced. Additionally, it's important to ask about family illnesses, as this can reveal genetic or hereditary factors that might influence the patient's condition. We also review the pre-medical history, which includes any previous health issues or treatments the patient has undergone. All these elements are interconnected and help us build a comprehensive understanding of the patient's health, guiding us in planning effective interventions. Remember, thorough history collection is foundational to delivering holistic and patient-centered care in the community setting. Now, let's talk about the actions we need to take when responding to a patient's condition. First, it's crucial to find out what action has already been taken. This helps us understand their current status and avoid unnecessary duplication. Next, we must assess for any complications and note any specific details that could influence our care plan. Checking vital signs and recording them accurately gives us a clear picture of the patient's physiological state. Conducting a urine test can provide valuable information about their overall health and potential underlying issues. Once we gather all this information, we can identify the problem more precisely. Based on our assessment, we then provide the appropriate nursing services to address the patient's needs. It's also important to offer emotional support by consoling the individual and their family, helping them cope with the situation. If necessary, we implement a referral system to ensure the patient receives specialized care or additional support. By following these steps, we ensure a comprehensive, patient-centered approach that aligns with the overall goal of delivering effective and compassionate care. Let's talk about the importance of regular study and monitoring of the Standing Order Manual or Health Book. It's essential to stay updated and ensure that everyone is following the correct procedures. If you notice any issues or uncertainties, you should immediately inform the health officer. Prompt communication helps us respond quickly and effectively. Remember to notify the communicable disease team without delay if any cases arise. Having the medicine kit ready at all times is crucial, so we're prepared to handle emergencies swiftly. If you're ever in doubt about the standing order, don't hesitate to gather complete information before taking any action. It's also important to be careful about medication limits and to maintain faith in our protocols. When we follow these guidelines carefully, we help create a safe and healthful environment for everyone. In essence, consistent monitoring, quick communication, preparedness, and adherence to procedures are key to maintaining health and safety standards. This approach ties everything together and helps us achieve our overall goal of a safe, healthy community.